Welcome to the Explainer. So, today we're tackling one of the most fascinating diagnostic puzzles out there, acute appendicitis. If you've ever had a friend or family member rush to the ER at 2 a.m. with that unbearable abdominal pain, you know it's a huge surgical emergency. But how do doctors actually figure out what's going on deep inside without, making a single incision? Well, today we're putting on our detective hats. We're going to use sonographically explained images in easy language to uncover the exact clues they look for.
You really gotta wonder, right? How do doctors actually see your pain? When a patient is in absolute agony, medical teams have this incredible, totally non-invasive tool ready to go, the ultrasound machine. It's the absolute first-line go-to for solving this mystery. And the best part, instead of using radiation, like a CT scan or an X-ray, it relies purely on high-frequency sound waves. These waves literally bounce off your internal organs to create a live, moving picture. Because it's completely radiation-free, it is an absolute game changer, especially for kids, young adults, and pregnant women. It's safe, it's incredibly fast, and as we'll see, it reveals pretty much the whole shebang.
Okay, let's dive right into Section 1, the suspect, the normal appendix. When radiologists look at a grayscale ultrasound, they're hunting for a very specific structure. The official medical definition is a compressible, blind-ending tubular structure. But let's translate that dense jargon into some easy language, shall we? It's basically a tiny, squishy cul-de-sac right there in your abdomen. When the doctor presses the ultrasound probe down on your belly, a healthy, normal appendix will just flatten out. It squishes under the pressure, kind of like an empty toothpaste tube. And because it's a cul-de-sac, it has a very distinct dead end. Now, size is literally everything when it comes to ruling out our prime suspect. A normal, healthy appendix is incredibly tiny. In fact, it should measure less than 6 millimeters in outer diameter. To put that into perspective, 6 millimeters is roughly the size of a standard pencil eraser. So when the sound waves map out this tiny, squishy structure and it clocks in under 6 millimeters, the radiologist can breathe a massive sigh of relief. The appendix is completely innocent. All right, moving on to Section 2, the core clues, signs of trouble. Now, what's really interesting here is the stark contrast between a healthy state and our biggest diagnostic sign. Remember how we just said a normal appendix squishes under pressure and is under 6 millimeters? Well, an inflamed appendix does the exact opposite. It becomes this enlarged, completely non-compressible tube measuring way over 6 millimeters. Because it's absolutely packed with inflammation and fluid, it acts exactly like a swollen, rigid water balloon. When the doctor pushes down, it just won't flatten. That lack of squish, combined with a diameter jumping up to 7, 8, or even 10 millimeters, is an absolutely massive red flag. Let's see how this builds when we switch up our viewing angle. If the radiologist turns the probe to take a cross-sectional look, imagine slicing a loaf of bread to look at the inside piece, they'll often see what's called the target sign. Because the wall of the inflamed appendix is so incredibly swollen, it creates these concentric circles. It has this dark, thickened outer ring, what the pros call a hypoechoic wall, surrounding a brighter center. It literally resembles a bullseye. This is our second major visual clue that something is very wrong. But sometimes a good detective needs to find the exact trigger of the crime. Enter the appendicolith. Medical textbooks call this an echogenic focus with posterior acoustic shadowing. But again, keeping it to easy language, an appendicolith is basically just a calcified deposit, a hard little stone that's gotten stuck inside the appendix. Because this stone is so solid, the sound waves can't pass through it at all. They just bounce right back, which creates this super bright white spot and casts a dark, distinct shadow directly behind it. When doctors spot this bright stone and its dark shadow, it hugely increases the odds of acute appendicitis, because that little stone is actively blocking our cul-de-sac. So we've got the size, that rigid water balloon feel, the bullseye, and maybe even a shadowing stone. But hey, your body isn't just sitting idle, it's fighting back. To see this reaction, the radiologist will flip on a tool called color Doppler. And when they do, the whole picture transforms into what I can really only describe as a massive traffic jam of blood flow. The technical term for this traffic jam is hyperemia. Basically, hyperemia just means increased vascularity, or a huge surge of blood flow rushing to the appendiceal wall. Because of active inflammation, your immune system is detecting an infection and it's sending emergency reinforcements fast. On the monitor, the color Doppler picks up this movement and paints it in vivid red and blue signals. So, instead of quiet dark tissue, the inflamed appendix suddenly lights up. It's just a chaotic rush of blood flow wrapping completely around it. It's a stunning visual confirmation that a fiery inflammatory battle is raging right there in the abdomen.
Which brings us to section 3, the scene of the crime, collateral damage.
And this brilliantly illustrates the collateral damage doctors look for. See, surrounding the appendix is normal abdominal fat, but when that fat gets inflamed, it turns bright white or echogenic. Radiologists might also spot small, dark pockets of free fluid that have essentially leaked out from all the swelling. The local mesenteric lymph nodes often become noticeably enlarged too, as the immune system kicks into high gear. And finally, there's a very physical clue, localized tenderness. When the ultrasound probe is pressed directly over the appendix, the patient will feel maximal tenderness right at that exact spot. So, what does this all mean and why the rush? Well, without early diagnosis, the situation goes downhill fast, leading to complicated appendicitis. If the pressure builds too much, the ultrasound might actually show wall disruption, meaning the appendix has perforated or burst. And that leads to really dangerous complications like a periappendiceal abscess, which is a contained pocket of infection, or a phlegmon, which is basically a spreading mass of inflammation. This is the absolute worst case scenario our sonographic detectives are trying to prevent. Okay, let's bring it all together into our final detective checklist. A doctor confirms acute appendicitis when they find a rigid, non-compressible appendix that's larger than 6 millimeters. They're looking for that thickened wall shaping up into a bullseye target sign. They're scanning for a shadowing stone or appendiculith. They switch on color Doppler to find that hyperemic traffic jam of blood flow. And finally, they check the surrounding area for bright inflamed fat and leaking fluid. Piecing all these sonographic clues together early means prompt surgical treatment. It stops a burst appendix before it happens, and it massively reduces complications. It is honestly mind-blowing how much crucial information we can gather just by sending simple sound waves into the human body, isn't it? By understanding what normal, squishy tissue looks like compared to rigid, inflamed tissue, doctors can safely and quickly solve a life-threatening emergency. So I'll leave you with this. Next time you or someone you know has a really severe stomachache, what will the sound waves say about you? Thank you so much for joining me on this explainer. I hope you found decoding the body's emergencies as fascinating as I do. Keep exploring and keep learning.